Hello everyone, welcome back to my channel Dr. Shil's Physio Victory. Today we will discuss most important MCQs of Gait Cycle and Pathological Gait which are frequently asked in different competitive exams. Let's start. Today's first question is double support phase present at dash phase of Gait Cycle. Option A beginning of stance. Option B end of stance. Option C beginning and end of stance, and option D mid stance. Here the correct answer is option C beginning and end of stance phase. So this is initial double support and this is terminal double support. Initial double support occurs at beginning of the stance phase from initial contact to loading response. From initial contact to loading response. Both feet touch the ground, and in the terminal double support phase occurs at the end of the stance phase from terminal stance to the from terminal stance to the pre-swing phase. So it provides maximum stability present only in walking, absent in running. Next question. Question number 2. Stance phase is dash percentage of gait cycle. This is a very easy question. The answer is 60%. Tell me in the comment box the percentage of swing phase. Next question. The point of initial contact of one lower limb to the point at which the same limb contacts the ground again is called option A stance phase, option B gait cycle, option C single limb support, and option D none of the above. Here the clear answer is option B gait cycle. A gait cycle is defined as the point of initial contact of one lower limb to the point at which the same limb contacts the ground. Okay. Next question. Question number 4. Newton's first law of motion is applicable to which phase of gait cycle? Option A stance phase, option B swing phase, option C mid stance, and option D push off. Here the correct answer is option B swing phase. So the Newton's first law said a body contains in its state of rest or motion unless acted upon by an external force. So during swing phase, the limb behaves like a pendulum. Once initiated, the leg continues swinging due to inertia. Therefore, the swinging limb movement follows Newton's first law. Next question. Question number 5. The COG displaced to the highest level during dash phase of gait cycle. Option A foot flat, option B mid stance, option C double support, and option D mid swing. Here the correct answer is option B mid stance. During walking, the center of gravity vertically. Moves vertically when so during mid stance is the highest. During double support it will be the lowest. Next question, question number 6. In-toeing gait is the characteristic of dash. Option A, coxa valga. Option B, coxa vara. Option C, anteversion. And option D, retroversion. Here, the correct answer is option C, anteversion. Femoral anteversion means the neck of the femur rotates. Anteversion means neck of femur rotates anteriorly. So the internal rotation of femur. Toes point inward, generally seen in children. So this is the image. Here you can see this image shows femoral anteversion and internal rotation of the femur. This is called the toe, toe in gait, and in the right side image, this image is called femoral retroversion, where there is a rotation of femur in the outward side. This is also called the toe out gait. Next question, question number 7. Person with quadriceps weakness walks with equinus gait, correction of which leads to option A, will lose the independent ambulation. Option B, improves the cosmetics and function, osmosis and function. Option C, strengthen the quadriceps. And option D, none of the above. Here the correct answer is option A, it will lose the independent ambulation. Next question, question number 8. RLA term for heel off is option A, loading response. Option B, mid stance. Option C, terminal stance. And option D, free swing. Here the correct answer is option C, terminal swing. So this is in left side, this is the traditional method, and in right side there is RLA method. In traditional method, the first step is heel strike when heel touches the ground, and in RLA, heel strike is correlated with the initial contact, then foot flat, which is correlated with the loading response. In mid stance, this is same in both cases. Then heel off is correlated with the terminal stance, and toe off is correlated with the pre swing. And in swing phase, acceleration correlates with the initial swing. Mid, it will be mid swing. Mid swing is correlated with the, here is also be mid swing. And deceleration is correlated with the terminal swing. You should remember this. This is very important. Next question. A therapist completes a gait analysis of a patient rehabilitating from a motor vehicle accident. Which descriptive term is not associated with the stance phase of the gait cycle? I have just discussed right now. So the options are option A heel strike, option B deceleration, option C loading response, and option D mid stance. Here the correct answer is option B deceleration. Deceleration is the term associated with the swing phase. Next question, question number 10. Time taken to complete one stride is dash second. Here the options are option A 5, option B 2, option C 1, and option D 3. Here the correct answer is option C 1. It will be 1 second for stride time. You should remember cadence is 110 to 120 steps per minute. So one heel strike to the another leg heel strike is called the step length, and one heel strike to consecutive same leg heel strike is called the stride length. Next question. Average axial rotation of the lower extremity during walking is option A 8 degree, option B 16 degree, option C 24 degree, and option D 32 degree. Here the correct answer is option A 8 degree. During normal walking, the lower extremity and the pelvis rotates in the transverse plane to increase step length and reduce vertical displacement of the center of gravity. It's generally 8 degree internal or external rotation. Next question. The body weight is directly over the supporting lower extremity at option A heel off, option B foot flat, option C mid stance, and option D terminal stance. Here the correct answer is option C mid stance. The body passes directly over the supporting foot. The center of gravity is highest. So next question, question number 13. The most energy efficient gait is option A walking on usual walking habit, option B walking with a slower speed, option C with brisk walking, and option D none of the above. Here the correct answer is option A walking on an usual walking habit. Humans naturally select a self-selected comfortable walking speed which minimizes oxygen consumption. This is called energy efficient gait. Average comfortable walking speed is 1.2 to 1.4 meter per second. Next question, question number 14. The linear displacement or the linear distance between two successive points of contact of opposite limbs is option A stride length, option B step length, option C width of base of support, and option D none of the above. Here the correct answer is very easy, that is option B step length. So this is step length. One leg heel strike to another leg heel strike. Next question. Antalgic gait is characterized by option A smaller step on the affected side, option B smaller step on the sound side, option C lurching on the sound side, option D inadequate swing on the affected side. Here the correct answer is option A smaller step on the affected side. Next question, question number 16. Running is distinguished from walking by option A, cadence more than 130, option B, absence of double support phase, option C, reduced base of support, and option D, all of the above. Here, the correct answer is option D, all of the above. Next question, question number 17. Stiff knee gait is characterized by option A, lurching, option B, hand to knee gait, option C, hip hiking, and option D, step edge gait. Here, the correct answer is option C, hip hiking. Stiff knee gait occurs when knee flexion during swing phase is limited due to quadricep spasticity or knee joint stiffness. To clear the foot during swing, the patient compensates by hip hiking. Lurching gait is generally seen in gluteus maximus weakness, hand to knee gait generally seen in the quadriceps weakness, and step edge gait. Tell me in the comment box due to which muscle weakness step edge gait occurs. Next question, question number 18. In high step edge gait, there is paralysis of option A, dorsiflexor of ankle, option B, plantar flexion of ankle, option C, extensor of knee joint, and option D, flexor of the hip joint. Here, the correct answer is option A, dorsiflexor of the ankle. Tell me in the comment box which nerve injury leads to dorsiflexor weakness. Next question, bilateral weakness of gluteus medius results in option A, Trendelenburg gait, option B, waddling gait, option C, lurching gait, and option D, circumdactory gait. Here, the correct answer is option B, waddling gait. Gluteus medius is a primary hip abductor that stabilizes the pelvis during the walking. In both-sided weakness, pelvic drops alternatively and trunk shift side to side, which leads to waddling gait. Trendelenburg occurs in the unilateral gluteus medius weakness. Tell me in the comment box where circumdactory gait generally seen. Next question, question number 20. Athetoid cerebral palsy child will have. Option A, lurching gait. Option B, hand to knee gait. Option C, Caesarean gait. Option D, circumdactyly gait. Here, the correct answer is option C, Caesarean gait. Athetoid cerebral palsy characterized by involuntary writing movement, poor motor control. Next question, question number 21. Calcaneal gait is due to weakness of option A, quadriceps, option B, dorsiflexors, option C, gluteus medius, and option D, plantar flexor. Here, the correct answer is option D, plantar flexor. Calcaneal gait occurs when plantar flexor muscle, that means gastrocnemius and soleus weakness. Next question, question number 22. Shuffling gait is seen in option A, Parkinson's disease, option B, polio, option C, cerebellar dysfunction, and option D, spinal cord lesion. Here, the correct answer is option A, Parkinson's disease. Shuffling gait is characteristics of Parkinson's disease. Features short steps is also called fascinating gait, increased speed. Next question. Uh, Before going to next question, we should discuss the other point. Spinal cord lesion leads to spastic or Caesarean gait. Caesarean gait. Cerebellar dysfunction leads to ataxic gait, and polio usually occurs muscle weakness. Generally, if the quadricep muscle weakness or paralysis is present, so we can see hand to knee gait in polio. Next question, question number 23. Between heel strike and foot flat, hip extensor work dash and knee extensor contracts dash. Option A, eccentric, concentric. Option B, concentric, eccentric. Option C, isometric, concentric. And option D, concentric and isometric. Here, the correct answer is option B, concentric contraction of the hip extensor and eccentric contraction of the knee extensor. In this image, we can see from initial contact to foot flat, there is reduction of hip flexion from 20 degree to 15 degree. So, hip flexion reduction means there is hip extension which occurs by the concentric contraction of the hip extensor, and in knee joint there is 0 degree knee flexion to 15 degree knee flexion. So knee flexion is occurs by the concentric contraction of the eccentric contraction of the knee extensor due to the knee extensor eccentric contraction. Next question. Weakness of hip flexors leads to option A abducted gait, option B lurching gait, option C Trendelenburg's gait, and option D circumduction gait. Here the correct answer is option D circumduction gait. Hip flexors, mainly the iliopsoas, initiate the swing phase. If there is hip flexor weakness, limb cannot be lifted easily and patient swings leg outwards in the semicircle. This produces circumduction gait, generally seen in the stroke patient. Next question, question number 25. At mid-stance phase of gait cycle, line of gravity passes behind the hip joint, creating flexion movement. Weakness of gluteus maximus gives rise to dash gait. Option A, hand to thigh gait. Option B, anterior trunk bending. Option C, posterior lurching. And option D, hip hiking. Here the correct answer is option C, posterior lurching. Thank you for watching this video. Please do like and subscribe to my channel. If you find the video is helpful to you, share with your friends, comment in the comment section. If you find anything wrong,